Here are some common antibiotics, along with their typical uses, potential side effects, and contraindications. 1. Amoxicillin. Uses amoxicillin is often prescribed for various bacterial infections, including respiratory tract infections, ear infections, and urinary tract infections. Side effects. Common side effects may include diarrhea, nausea, and skin rash. Allergic reactions are possible but rare. Contraindications. Individuals with a history of allergic reactions to penicillin should avoid amoxicillin. 2. Azithromycin. Uses. Azithromycin is commonly used for respiratory tract infections, including bronchitis and pneumonia, as well as some sexually transmitted infections. Side effects. Side effects can include diarrhea, nausea, and abdominal pain. It may interact with other medications, so it's essential to inform your healthcare provider of any other drugs you're taking. Contraindications. People with a known hypersensitivity to azithromycin or any macrolide antibiotics should not take it. 3. Ciprofloxacin. Uses. Ciprofloxacin is a broad-spectrum antibiotic used for urinary tract infections, skin and soft tissue infections, and respiratory infections. Side effects. Side effects may include nausea, diarrhea, and an increased risk of tendinitis and tendon rupture. It should be used with caution in children and pregnant women. Contraindications. Contraindications include a history of hypersensitivity to ciprofloxacin and certain neurological conditions. 4. Doxycycline. Uses. Doxycycline is used for various bacterial infections, including acne, Lyme disease, and certain respiratory and sexually transmitted infections. Side effects. Common side effects include gastrointestinal upset and increased sensitivity to sunlight. It should not be taken during pregnancy or in young children due to potential tooth discoloration. Contraindications. People with a history of allergic reactions to tetracycline antibiotics should avoid doxycycline. 5. Clarithromycin. Uses. Clarithromycin is used for respiratory tract infections, such as bronchitis and sinusitis, as well as some stomach ulcers associated with H. pylori infection. Side effects. Common side effects include diarrhea, nausea, and altered taste perception. It may interact with various medications, so consult your healthcare provider about potential drug interactions. Contraindications. People with a history of allergic reactions to macrolide antibiotics or a history of liver problems should avoid clarithromycin. 6. Metronidazole. Uses. The metronidazole is primarily used for infections caused by anaerobic bacteria and certain parasitic infections, including amoebiasis and giardiasis. Side effects. Common side effects include nausea and a metallic taste in the mouth. Alcohol should be avoided during treatment with metronidazole as it can cause severe reactions. Contraindications. Individuals with a history of hypersensitivity to metronidazole or any nitroimidazole antibiotic should not take it. It's important to note that antibiotic use should always be under the guidance of a healthcare professional. Antibiotics should be taken as prescribed, and individuals should communicate any side effects or concerns to their healthcare provider. Additionally, antibiotic resistance is a growing concern, so antibiotics should only be used when medically necessary.